Hi guys, the next video I'm going to do is giving a complete or partial bath. We are doing the complete bath. In the Evolve skills, the difference between a complete and a partial, the partial that they describe is that the patient partially that you're partially assisting them, whereas partial to us used to be half of the body. Equipment, soap, deodorant, or antiperspirant, powder, lotion, 2 bath towels, gloves, clothing, 2 hand towels, bath thermometer, orange wood sticker, nail file, wash basin, paper towels, washcloth, bath blanket, brush and comb, and other grooming items as requested. Let's see, let's go down to step 7. That is the first one that's a little bit different. Covered the overhead table with a paper towel. Again, creating that barrier to put our supplies on top of that. It's not a start, but they would need to do that to get that. Raise the bed to that about waist high. Step 9 is performed hand hygiene and put on gloves. Step 10 is removing the clothing, the gown, and making sure that they're not exposed. And then followed agency policy for sleepwear. Again, what does that look like to that patient? Facilitating instructors maybe explain that to them, that, asking the patient, do you want these to go to the dirty clothes? Again, letting that patient to direct those. And again, they may be doing it with the mannequin, but they can ask that patient, do you want your sleepwear to go to the dirty laundry? Again, if they do that, if they remove the sleepwear, they didn't expose them, and then they ask them, do you want this to go to laundry? They would get the points for that. Or they may even say, I would check facility policy. That's okay too. Cover the person with a bath blanket, remove top linens, lowered the head of the bed. It was as flat as possible. The person had at least one pillow. Step 13 is a critical. I'm not so much concerned about how much water they put in it. It says 2/3. The big thing is we want them to test the temperature. They may say I would fill the basin to where it wasn't too full to whenever I walked, that it sloshed out. The big thing, so that would indicate that they're looking at the safety, those kind of things, and that would be a great thing if they said something like that. They'd use the bath thermometer, and we want it between 105 and 109. And they may say something that the water temperature would be 105 or 109, or any special needs according to the care plan. We want them to understand, and the reason why that says that about the care plan is not every patient can tolerate that 109, or maybe they need it cooler because of their disease process, or they're running a fever, and whatever that looks like for that patient. So we want them to understand that there may be variables in that, so that's why that statement is in there about the care plan. And then measuring the water temperature according to facility policy. So something in there to get the points with that is they would say they'd fill the wash basin to a safe level. If they said I would fill the wash basin to a safe level, I would check the care plan to make sure that 105 to 109 is a suitable temperature. They would get the points for that, because that tells me they're looking at the safety, they're looking at the patient's individual needs, and that's how they governed that starred item, okay? This one might have a lot of questions. If you guys have questions, please ask, because that's a lot of words in there. But again, we wanted safety. Did they identify the safeness of the temperature? So those things that were safe. They could have the patient in step 14 check the water temperature, adjusted it if it was too hot or too cold. That made a mitt with the washcloth, it shows how to do that on the video. it's not starred. You know, if they just use a washcloth and use the clean part like we have before, you know, it's probably, I mean, it's not a starred item. They'll lose 1 point. 18, washed around the person's eyes. They didn't use soap. Cleaned the far eye first and then gently wiped from inner to outer, and then cleaned around the eye near you. Now again, if they did that out of order, it's not starred. So if they missed that point, remember that they're going to trigger something in that key concepts as well. So they would also list 2 points for probably infection control or something else for step 18. And then that soap for the rest of the face, and then wash the face, ears, and necks. Rinse, pat it dry with a towel on the chest. Expose the far arm, place the bath towel lengthwise under that arm, applied soap to the washcloth, supported the arm with the palm under that person's elbow, and then wash the arm, shoulder, underarm using long, firm strokes. Place the basin on the towel, and then you do the hand and then the orange wood stick, and then have the person exercise their fingers in the water. Remove the basin, dry the hand, cover the arm with a blanket. Step 28, they only have to do this with one arm, with that far arm, and then they just say they repeated. Now, if they do the other arm, you know, just let them do it. You could tell them that they don't have to do if they just if they start to repeat it, they would still get that point even if they started to do it or did that other arm. Same thing with the other, let's see, with the leg, it's going to be the same scenario. They could do it, but remember, you're going to be limited time and a limited testers. So if they start to do it, that's fine. They repeated it, you know, kind of thing. Or they could just tell you, well, I would do the same thing to the other leg. Either scenario is going to get them points. But I would caution them, stop them from doing the whole other thing for time purposes. Our labs, we aren't going to have time to do, you know, complete everything. We just want to see what they're doing that is accurate. .46, they changed the water again. That one isn't starred. They identified in the first, you know, that the temperatures and stuff, so that one's not starred. Again, it says on 47, they will make a statement such as asking the patient, do you want to do your own peri-care and wash where you can reach, and then I'll finish up. That's how they would get points to 47. And facilitating lab instructors, explain that to them when they're peer checking. And then we would do it if they couldn't. We won't do peri-care for this skill because we do it on actual the peri-care skill. We can ask the patient at that time. The student for step 49 should ask the patient, do you want a back massage at this time? We won't do it, but we want them to know that that's a very good time to ask them if they're relaxed. So that's when we would want them to ask that. And for combing and brushing the hair, they won't actually do it. They can ask, do you want me to comb and brush your hair? Now, our mannequins do have wigs, so we can, you know, put those on there. But at least have them identify and asking the patient, do you want your hair combed? And do you have any special way that you want me to comb it? So then they're, again, it's patient directed, okay? I don't think anything else, everything else is pretty much self-explanatory. Again, that'll conclude giving a patient a complete bath. If you have any questions, please respond or reply to this discussion after the video, and we'll have some good communication and good dialogue going on. Thank you so much.